Okay, so now we are going to look at some of the high yield questions that are often repeated in different exams, like maturation reflex center is present in pons. In pons, there is maturation center present. Light chain amyloidosis is of answer will be primary systemic type. In primary systemic type, there is light chain amyloidosis is present. Another question is vitamin required for prothrombin activation is vitamin K. Prothrombin activation requires vitamin K. Next one is autosomal dominant is feature which is complete viable present, which is present uh, viable presentation. What will increase at rest in athletes? In athletes, there will be decreased heart rate and increased cardiac output because their hearts adapt to that hard work. So, increased cardiac output will be there and increased stroke volume will be there at the rest. Cause of dull percussion because of fluid in the pleural cavity. Dull percussion will be there and in pleural effusion there will be stone dull percussion and pellagra niacin deficiency. Pellagra occurs because of niacin deficiency. 3Ds we remember dementia, dermatitis and diarrhea. A boy having to eat fast food MCV 120 diagnosed will be folate deficiency, means vitamin B12 deficiency and folate deficiency results into the megaloblastic anemia, and that MCV will be 120 which results into the megaloblastic anemia are indicative of megaloblastic anemia. Another is steroids long-term complication. Steroids long-term complication is when a person getting steroids for a long term, then there will be osteoporosis and fracture in that person. Feature of septic shock. In septic shock there will be increased cardiac output in the patient. When cardiac output will be increased, septic shock can be considered in types of shock. Another is hemoglobin binds with affinity. Okay, so let me O2 affinity factor is hemoglobin in the binding, hemoglobin in the blood. Hemolytic transfusion reaction occurs and it results into the hemoglobinuria, means hemoglobin or blood in the urine will be there because of hemolysis. Hemoglobin will leak out of the kidneys. That's why we always give Lasix to the transfusion reaction patients. Muscle injury assessment is done with CKMB. In muscle injury, there will be CKMB. Posterior hypothalamus there will be shivering. In posterior hypothalamus nucleus will cause shivering. uh, Posterior hypothalamus nucleus stimulation results into shivering in the patient. Okay, so the last point is acute tonsillitis patient having fever chill. Chemical mediator for fever is IL-1 and TNF, and the chemical mediator for fever and chills is IL-1 and tissue necrotic factor. These mediates fever in the patient. So these are some of the high yield questions which you must memorize. That transfusion reaction results in the hemoglobinuria, vitamin K required by prothrombin, amyloidosis having primary systemic types, maturation center is present in the pons, and stroke volume increase in athletes, fluid with dull percussion, niacin 3D deficiency, and 120 MCV is indicative of megaloblastic anemia.